Biologics. That's a Cleveland-based company that's been working with Purdue University on a new very high-tech type of sensor and a device that is trying to make it quicker and easier to find COVID-19. Of course, testing in this country is at the forefront of the COVID-19 situation, always trying to find new ways to get better and faster testing and more reliable. And we'll get into that in just a second. I'm going to welcome in now Dr. Hummer again. He is with IdentifySensors Biologics. Doctor, first of all, good morning. How are you today?
I'm great, thanks.
Excellent. Well, we're glad to have you. And we don't want to get super deep in the weeds because we're all trying to get our hands and heads around COVID-19 and testing. Explain to me why your new way of testing, this sort of idea, what is new about it and why is it different?
Well, we have a fast, accurate, very reliable COVID test that's a self-test that you do at home, and it goes to the smartphone. And it focuses on the molecular test versus the chemical test. And what we have here now is two science coming together. That you have electrochemistry and you have bioassays. And we put those together, and that enables this test to be done. It's fast, accurate, it's reliable, and it's done at home by yourself on saliva, and it's very, very accurate.
And so now you've piqued my curiosity as a test that is done at home. I already think there are a lot of people who question the accuracy of a lot of the tests we're seeing. How am I supposed to do my own test at home and this is considered accurate?
Right. Well, the present gold standard is called an RT-PCR test, and that's been around for 50 years. And that has a lot of moving parts to it. You have to have a lab technician run it. You have to be in a lab. You have to collect the specimen. You have to transport the specimen. What we do is we allow a test to be done at home on the person's saliva. You simply drip your saliva on the electrode, and within 30 minutes, we will tell you if you have COVID or not. And it eliminates all the variables. And it's very accurate. It's a genetic test. It works and looks for the molecular genes of COVID-19. So it's not a surface antigen test. And the surface antigen tests that are out there today are giving a lot of false positives. This test will not give a false positive.
Let's talk about that 15-minute rapid test. We've seen our own governor here in the state of Ohio get a false positive. What is your track record? What type of I believe the rapid test has a 15% flaw or 15% inaccuracy rate. So far, what kind of testing have you done? What kind of numbers and how accurate?
Well, as you know, we're working with Purdue right now, at Purdue in the labs to functionalize this, to bring this to the market sometime in 2021, midsummer. And the way this test works is very, very unique. And if the gene is there, if the COVID is there, we have a positive test. If it isn't, you have a negative test. Versus what's happening today with all these, and you mentioned 15%, but it's probably much higher than 15% for false positives. I know many of my friends thought they were sick. They went and they got a test. It was negative or it was positive, and it was wrong. So we need more testing. We need a test where you can do it at home. And if it's positive, you stay home. If it's negative, you go to work. And you can do it every day if you need to. So if you become positive, you can test yourself every day until you turn negative and then go to work. This will help keep the economy open.
I mean, this is mind-blowing stuff here. This is a sort of pandemic-changing advancements. But again, can you give me a percent how efficient your new testing device is? How accurate? What kind of a false negatives or false positives are you getting?
Well, it's going to be as accurate as the gold standard PCR test, but and that is accurate to 95 to 97%. And that's what our test is. It's the same molecular test as the PCR test, but it does away with all the inherent difficulties, and it's done at home. So it's going to be a game changer, not only for America, but the world. this is a giant leap for mankind in terms of laboratory medicine, which really hasn't changed in about 50 years. This will enable you to have testing in your medicine cabinet. So that's a huge breakthrough.
And so what will this device look like? It connects to my phone. It obviously, you said earlier, I drip my saliva onto it. And what are we talking as far as cost? Do we have an idea what it's going to cost to have this device in my home?
We sure do. It's a small little device, probably the size that will fit in the palm of your hand. And when you put your saliva on, it'll send the signal via Bluetooth to your smartphone. The smartphone then encrypts it, sends it up to the cloud where it sees and analyzes the data, and then sends a text message back to you if you have positive or negative. And then it automatically does the routine standard reporting to the CDC and the state health lab. So the test will probably be less than $25 a test, versus the average cost of a test right now is about $150.
Wow. And so you're saying $25 for the individual device, or every time I try to do this, I need to have a new $25 device?
That's a great question, because the device has a reader to it and then electrodes. So the first time you buy it, it'll be about $25. But then after that, you can buy functionalized electrodes for a lot less. So, and this is really a platform test. It'll be functionalized to do influenza A, influenza B. And as we know, when you get sick with a fever in this flu season, 9 out of 10 times, you're probably not going to have COVID. You're going to have some sort of flu virus. And these tests will be able to tell you that in the future. Like I said, 2021 midsummer is when we hope to bring this to the market. You'll be able to buy it in a CBS, a Walmart, we hope, and wherever there's a drugstore.
So let's walk through. I'm assuming there has to be some level of approval here. Are we talking FDA approval? And where are you in that process?
Right. Right now, we're in pre-EUA. EUA stands for Emergency Use Authorization. So we're talking with the FDA right now. We hope to get FDA approval under EUA status probably in about 3 months from now or sooner. So that's all good news. And another thing, too, is the FDA is not any longer looking for these more complicated tests. They're looking for a test just like ours that solves the problem.
And we are talking with Dr. Gregory Hummer. The fact that you are a Cleveland company, if this comes to fruition, and is this landing on the moon game changer as you're describing it, there's some pride factor here that this is something being developed right here in Northeast Ohio.
That's correct. We've been working on this for a long time in the food sector. We developed our sensors originally to check for E. coli and these killer bacteria on lettuce and things like that. But we found out working with Purdue that this technology was easily amendable to work with detecting viruses, and particularly COVID-19. So yeah, we all started right here in Cleveland.
Doctor, I want to thank you for your time. This is incredibly, I guess, uplifting, and hopeful is another word. Obviously, just like the vaccine, we all wish we could have these devices and the vaccine. We wish we could have it today or tomorrow, but there's just going to take some time. So we will look for your device, and we'll track the future of your device here in the future. Again, this is from IdentifySensors Biologics, based here in Cleveland. Dr. Hummer, thank you for your time today.
You're welcome. Thank you very much.
Take care. We're going to wrap up this report on, again, when we get new information, new devices, new testing, even advances in vaccines. We've seen Case Western Reserve University Hospital sign on to a number of these phase 3, stage 3 trials for vaccine. We bring it to you right here on our digital platforms as we are all looking for a way out of this COVID situation. I'm Dan DeRosa with 19 News Now. Hope you have a good afternoon. We'll see you on the news.
19 News. First, fair, everywhere.